Welcome to part 3 of the Diane Show. We are still talking family planning. My name is Diane Nabimanya Mtekanga. I am still with Mary Ann. So Musawo, let's start with misconceptions. Most people say when you're using family planning, you gain a lot of weight, which is mainly true. When you're using family planning, you're mostly frustrated, mood swings, your sexual libido comes from 100 to 5. You basically, your life takes a turn. What do you have to say about that? Because I mean, most of these things I have experienced.
Yes, they happen. They are there. But the most important thing is once you identify that this side effect, like you've started gaining weight, what do? Are you liking the weight? There are those who like gaining weight.
Yeah.
And there are those also not just gaining, there are people who lose weight as well.
Yes, I've heard of that.
Yes, and there's also someone who will remain, her weight remains constant. She's not gaining, she's not losing. So it depends on how you see it.
It depends on your body type and how your body
and how
receives.
you feel about it.
Okay.
Yeah, if I'm losing weight, well, I would keep the method. And if you're gaining and everyone is like, wow.
Oh, you look nice.
Yes, you keep it. But if it's doing the reverse, you come back. And during these sessions, we tell you this is about to happen. But also, you need to mind
what you eat,
your lifestyle
how many
as well.
times you eat.
And also during the session, you look at your weight. For example, if you're, let's take an example of like 85, and you want to go the hormonal way, there are chances you gain more weight. Yeah. And those are some of the contraindications to some of these hormonal methods. For example, you're not supposed to use a hormonal method if you're 75 kgs plus. Yeah.
Okay.
So we look at weight that way, but also act fast. Yeah. If you came in, you're 75 or 65, and for example, you're using the injector plan, and in 3 months you've gained 5 kgs, this should tell you
that something is
that
wrong.
This injection is for 3 months, and if in a month you've gained 5, there are chances you add more. So work on maybe what you're eating, and also maybe try and do some exercise. I've seen people lose weight with diet and exercise, much as because of the contraception. And there are those who actually the weight just keeps piling. But that decision of weight gain, it's something that should be expecting.
Okay.
For example, if you are to use the injector plan, you know it's in your body for 3 months. Yeah. If you have an implant, we can remove it anytime. Once you realize that you're
something
gaining and you've tried maybe also what you're eating, or maybe you don't even eat much. And also the reverse is true. If you're losing weight every day, you have an implant, it's not okay, it's not comfortable for you, just come back. You need to remove it and switch to something hormonal, non-hormonal.
Okay. So what do you do for people whose libido drops drastically? Sometimes you don't even want to look at your man because you're using family planning.
Yes.
Some people become completely dry. What do you do for such people? Do you have medicine that maybe, because I feel like libido is
we don't have medicine for apparently that effect of low libido. And also there are those who have high. It can be either way.
Hey,
yes.
There are those ones I've never heard of.
No. They are there. And once it happens, remember this conversation and this method, by the time you're taking the method, we also encourage couples to communicate. Like we ask you, Diane, is your partner aware you're doing this? And if he's not, well, it's a choice too. It's not that it's a must, he doesn't need to be there. But if you choose it this way, he needs to understand. And you also need to understand that if you get vaginal dryness, if your libido goes low, it's because of, for example, the implant or the injection. An implant you can remove immediately. The injection, it's there for 3 months. So we advise you to try like the lubricant, the KY jellies in the market, but also talking to your partner to understand that this is the hormone and this is what it's doing to your body. And once it's, for example, after 3 months, just don't use that method again.
Okay.
Switch to something else
That works for you.
that would work for
your
you.
body. That's
Yeah.
that very point is where I would love for you to
Yeah.
talk to our men out there. That when you touch, when out of the blue you want to touch the woman and she says no, I don't want, and she's using these methods, you should be able to understand and give grace.
Yes, and they don't know that some of these side effects because of family planning. And also sometimes also the women, you're not telling our men that you're on this method. So
Yeah.
you're doing it your way, but you also don't want to talk about it. But to the men, we appreciate the fact that they are coming for the sessions with their partners. Those who are
Yes.
coming, big up to you. You're doing a good job to understand these methods. But well, it's conversation, and this person getting to know that what is my wife using, you know, we have,
How does it affect her?
well, we have 2 babies, maybe our plan was 2, 3. Do you guys have this conversation, like, are you on IUD? Have you gone for family planning? Because also the cases of women getting pregnant soon after childbirth,
And
they're
many.
also very high.
They are very high.
Yeah,
They are
and
very
it's
high.
worrying.
Yeah,
And
because
it's,
someone goes on maternity leave and comes back pregnant.
Yeah. Even for example, like someone just gave birth 2 months ago, and she's pregnant again, regardless C-section or normal delivery. It's not how it's supposed to be. It's so unfortunate.
Imagine you're going through the nakawere phase and then you're pregnant again. You're throwing up.
Yeah, it's
Your
so
emotions are all over
unfortunate.
the place.
And you really see on the face drops, and it's something that is so bad because it contributes to a lot of maternal deaths.
Yeah.
And maternal morbidity, and also fetal abnormalities sometimes. Because imagine you're back from maternity leave and you're pregnant. People start hiding, you start doing antenatal, you're scared, but you need all these things. So for the men, I would like to encourage them to walk in to any reproductive health center, any hospital, any doctor. We are all informed you cannot offer the service. And get to know more. If your partner, if your wife is complaining of vaginal bleeding, maybe you've pushed her, go to the hospital. Maybe she's not taking it. The IUD is freaky. And you know she has an IUD. Come and find out what can be done. Yeah, so, and also not to fail to mention about vasectomy.
Oh, thank you so much, because I feel like family planning becomes a burden to women.
Yes.
There are things that have been introduced for men. Also, why don't they also go and cut their tubes so that we can be free from all these side effects of weight gain, headaches, stress?
Yeah, apparently science has not yet given men other options apart from vasectomy and the male condoms.
Okay.
So, but the numbers are coming through. Keep coming. We are seeing you and we appreciate you. So we encourage, it's a good conversation to have. Please walk in. We have very good success stories. The numbers are coming through, and it's good to embrace the family planning concept for good families and for good life.
Okay.
Yeah.
General advice as we close this
As we
session.
close, thank you so much. Family planning or contraceptives are here for every woman in her reproductive age. Please embrace the methods available. But most importantly, we are trying to phase out the myths and misconceptions by creating more awareness, giving you more information, trying to understand our bodies, and getting to know that we need to have healthy families, healthy parents and children, and have the desired number of children. Plan pregnancies, and you enjoy the journey.
You're excited about the children not conceiving, and you're frustrated. Your partner is frustrated, and
it's so unfortunate.
So
But
guys, thank you so much for watching the Diane Show. Your health is your right, your body is your own, and your choices matter. Remember to pass by Access Building, Zuka, We Know Skincare, to get your skincare products. I am Diane Nabimanya, and I have been with
Mary Ann.
Bye.